Good afternoon, everyone. My name is Manuel Carmona, spelled Manuelcarmona. I'm the Acting Director of Public Health for the City of Pasadena. The City of Pasadena Public Health Department has identified a locally acquired case of dengue. This is the first confirmed case of dengue in California not associated with travel, which is an extremely rare event of local transmission in the continental United States. While dengue can cause serious illness, the risk of ongoing transmission in the Pasadena community is very low. The Pasadena Public Health Department is sharing this information to raise awareness about the confirmed case with local transmission, to provide education to the public, and to share how the city and our partners are responding. The Pasadena Public Health Department has an established relationship with the San Gabriel Valley Mosquito and Vector Control District. And together we have been working to reduce local mosquito populations, monitor cases of mosquito-borne illnesses, prevent the spread of disease, and offer education to the community. To provide more information about dengue, its symptoms, and our responses, I introduce epidemiologist Dr. Matthew Feaster.
I'd like to thank you for being here today. I'm going to talk a little bit about dengue virus and what it is. Dengue virus is spread to humans through bites from infected Aedes species mosquitoes. Dengue virus is a human disease and does not spread to animals like our pets, and there is no human-to-human transmission. In the United States, dengue cases are typically only seen among individuals who have recently traveled outside of the country to areas that have higher levels of dengue. In the United States, we have noticed reported travel, in the United States, we have seen reported cases with no travel in Florida, Hawaii, Texas, and Arizona. Because the type of mosquitoes, specifically the Aedes mosquitoes, that spread dengue are common in our region, local spread is possible when an infected traveler is bitten by an Aedes mosquito and then bites another person. Though we wish to remind the public that the risk is very low and that this is the first time we have confirmed local spread in California. For people who do get sick with dengue, symptoms of dengue may be mild or severe, but typically include fever, nausea, vomiting, rash, and body aches. Symptoms typically only last 2 to 7 days, and although severe and even life-threatening illness can occur, most people recover in about a week. There is no specific therapy for dengue, but supportive treatments like rest, fluids, and monitoring for early signs are helpful. For our investigation, we were first notified of the suspect mosquito-borne case in late September and took immediate action to conduct enhanced surveillance and investigation. The first patient reported symptoms in mid-September. Given the person's symptoms, tests for mosquito-borne illnesses were ordered immediately. Those tests indicated elevated levels of antibodies for an arbovirus, or a virus that is carried by arthropods like mosquitoes, and it's a family of viruses that include West Nile and dengue. Our health department treated the case as a suspected mosquito-borne infection and sought to rule out dengue. During that time, our health department coordinated with Los Angeles County Department of Public Health and the California Department of Public Health to conduct additional specimen tests, specifically testing for dengue virus. After a thorough and comprehensive review of all available laboratory data results and in confirmation with the U.S. Centers for Disease Control and Prevention and the California Department of Public Health, we are confirming that this case is a locally acquired dengue case. At the first port of this potential case, we coordinated with our Vector Control District immediately to trap and test mosquitoes. At the time, all of the mosquitoes trapped were negative for mosquito-borne diseases, including dengue and West Nile. Spraying to control mosquito populations was also conducted well before we had a confirmatory diagnosis this morning. We will continue to allocate public health resources to investigate this case and the surrounding community, and will continue to partner with the CDC, our state health department, and our regional health departments, including Los Angeles County and Long Beach Department of Health and Human Services. I would like to remind the public at this time that the risk to the public remains very low, and we will update the public as we learn more through our investigations. I would also like to share, with the person's permission, that the person is recovering. We will not share any additional information about this person to ensure their confidentiality. Thank you.
And next, I would like to introduce Interim Health Officer, Dr. Parveen Kaur, who's going to talk a little bit about how residents in Pasadena and beyond can protect themselves and their loved ones.
Good afternoon, everyone. On this somewhat medically historic day in Pasadena, California, I'm Dr. Parveen Kaur, Interim Health Officer for the City of Pasadena. I spell my name as P-A-R-V-E-E-N, last name Kaur, K-A-U-R. Thank you to Mr. Carmona and Dr. Feaster for taking the lead on this and this great introduction. The first thing I want to emphasize is that the dengue virus, as mentioned before, is not transmitted from person to person. Secondly, most cases are actually asymptomatic, meaning they don't have any symptoms. And thirdly, there's a lot that we can do at individual levels, at our own levels, to protect ourselves from this disease. There is no specific antiviral treatment. Treatment is mostly supportive, as was said, meaning to say we support the symptoms until the patient gets better. I always say that prevention is better than cure. So what can we do to prevent this illness amongst us and our loved ones? The first thing is source control. By that, I mean decrease the overall mosquito population around us. Of course, the vector control department is going to be crucial in this and hugely impactful, but there are other things that we can do at our own level. Firstly, look for and get rid of any standing water in our backyards, in our neighborhood, in our yards, so that we eliminate the breeding grounds for mosquitoes. Secondly, we can prevent them from coming into our homes. Install screens on your doors and windows. And then, secondly, we protect ourselves from the bites of mosquitoes. And how do we do that? There are mosquito repellents. We have a lot of EPA or environmentally protectively approved mosquito repellents that can be used, especially at the times when mosquitoes at their maximum in their biting capacity. And secondly, we can wear long-sleeved clothes, long-sleeved shirts and long pants and loose clothes so that we minimize the access of mosquitoes biting to us. I would say also, if someone's planning to go out, discuss your travel plans with your healthcare provider to get some tips on how to protect yourself. And lastly, I will say, recognize your signs and symptoms so that if one falls into the category, please access and get to your healthcare provider so that you can be evaluated and confirmatory testing can be done. Thank you.
Next, I would like to invite up Jason Farned, who's the the district manager for the San Gabriel Valley Mosquito and Vector Control District.
The district has been working closely with the Pasadena Public Health Department to provide enhanced mosquito surveillance and control in the impacted area. We are also providing public health outreach and education to residents in the community. We are asking residents to help eliminate mosquito breeding sources and prevent mosquito bites. Our primary objective at this point is to reduce the mosquito population as much as possible in the impacted area and continue mosquito testing to identify any mosquito-borne diseases. I would like to stress that to date, all mosquitoes collected and tested in the San Gabriel Valley have tested negative for dengue. We are reminding residents that mosquitoes grow in water and asking everyone to tip, toss, and protect. That's tip out standing water. Even a container as small as a bottle cap can grow mosquitoes. And toss unused containers to prevent them from filling with water in the future. And also to protect themselves from mosquito bites using mosquito repellent with active ingredients approved by the EPA. And those ingredients are DEET, picaridin, IR3535, and oil of lemon eucalyptus. The district recommends that residents visit our website for more information about our services and to learn more about mosquitoes and mosquito bite prevention at sgvmosquito.org. The district is also making sure that we have staff available to take calls. We will remain open until 7 o'clock tonight and have operators available from 7 a.m. to 7 p.m. tomorrow, and then as needed in the future. So if you have any questions at all, please give us a call or consult our website. There is a lot of great information there on how you can eliminate mosquito breeding sources around your own home and protect yourself from mosquito bites, which is the best way to prevent mosquito-borne disease. Thank you.
The Pasadena Public Health Department will continue to track developments and work with our local, state, and federal public health partners to protect the community. I want to reiterate the risk of ongoing local transmission is very low. There are no restrictions on outdoor activities, but everyone has to do their part to reduce the potential exposure to mosquito-borne illness. We ask that everyone follow the standard precautions outlined today and address potential sources of mosquitoes on your property. Together, we can continue to protect and preserve community health. I want to acknowledge here today with me is City Manager for the City of Pasadena, Miguel Marquez. Of course, we have the two public health staff, and Dr. Matt Feaster, who's our epidemiologist, and our interim health officer, and Dr. Parveen Kaur. And we have Executive Director Jason Farned. In addition, we have representatives from Los Angeles County Department of Public Health, including Dr. Ayman Halai, who serves as a Unit Chief of Vector-Borne Diseases. We also have Long Beach Department of Health and Human Services Communicable Disease Investigator Sabrina Moran Gomez. And at this time, I would like to open it up for any questions you may have. Understood. I'm going to repeat the question just so that everybody can hear it. So the question is, if this person was not infected through travel, do we have any theories about how they might have been infected? For that, I'm going to ask Dr. Matt Feaster to come to the podium.
If a person did not have international travel, which is the typical route of transmission for dengue virus, then how might have this been introduced to this person? We are continuing our investigation. It may take a lot of time to understand where that, how that might have occurred, but we do know it had to have happened from someone who went to a country, got infected with dengue virus in an area where dengue is common, and flew home, and then had enough virus circulating that they were bit by an infected mosquito and then transmitted to a local resident here in Pasadena. The question was, did we contact the patient to seek treatment? We have been working closely with the patient. They sought care in the region and were treated successfully with our local medical partners. And we want to send thank you to the medical partners who are vigilant enough to notice the signs and symptoms and submitted this for testing. That is how we were made aware after the test results were made available to us. The question is, if the virus is in the community, could this pose a problem in the future? We know we have Aedes mosquitoes, which are the successful vectors here in our community. And we know that this is a problem that could pose future issues, but we do not believe that this is something that will continue to pose transmission issues or cause increased incidence in the year. It is something, though, that our health departments take very seriously, and our vector control districts, and we've been working for years to prepare for such a moment. And that's why we're very grateful to have our local public health partners and vector control partners here to show this sign of support that we have been preparing for this for quite some time. Yeah, the question is, can we explain a little bit further why we think this won't pose a significant risk going forward? Dengue virus is a human-only disease. It amplifies only in humans. And with vigilance and proper treatment, we can ensure that as a person, if they're infected, we can remove them. I should also say that the prevalence and incidence in the United States is low to no, meaning we do not see these locally acquired cases. This is a very rare occurrence. And so working closely with our medical community with enhanced surveillance, we can ensure that there will not be a continued transmission.
As a human disease, how contagious is it? The one thing that I mentioned earlier, that it is not contagious to humans. Man or humans are the end host for this infection. So it cannot be transmitted from person to person. There are very rare instances in which a pregnant woman can transmit it to her child, and it can be vertically transmitted. But those instances are very, very rare. Other than that, there is no human-to-human transmission.
So the question has been, has this been a particularly bad year for mosquitoes? And the simple answer is yes. Right now, or at the peak of our season, we were catching about 4 times the usual average for the mosquito population. Those population increases were primarily due to all of the additional rain. The summer thunderstorms that we were having were adding more water to the environment, creating more sources, and then also the continued warm temperatures throughout the nights. Traditionally, the nighttime temperatures have started to drop in the fall, where we're still seeing warmer temperatures, and so that has also extended the mosquito season longer than we generally see.
What's the comparison between West Nile and dengue, for example? West Nile is now a local disease. It was not. It was imported across the United States quite some time ago, but it is carried by our local mosquitoes, the Culex mosquitoes. And we've had a lot of time in our community to build up what is endemicity, meaning it's locally acquired, it is locally transmitted. West Nile, it can be a very serious disease. It's often asymptomatic. And for the most part, we know that people who get West Nile will often go undiagnosed because they might have a high fever, they might feel sluggish, a little tired, and might not report to care. So of the cases that are reported to our health department, we know it's an undercount. So we know West Nile is a very serious disease, and that we see it quite often in our community. And in rare cases, it can cause neurological symptoms that can include stiff neck, loss, confusion, and sometimes can be fatal, though very rarely. Dengue, on the other hand, being a mostly international disease in areas in the subtropics and tropics, is very rare to be reported to our health departments. We do get quite a few, or we get a few a year, and they are always associated with travel. They can be very serious, though the mortality rate is less than 1% among cases if they are properly treated.
Yeah, so Aedes aegypti generally have a flight range of about a quarter mile or so. So it's a very small flight range. And so to date, no invasive Aedes mosquitoes anywhere in San Gabriel Valley have tested positive for dengue. We will continue testing really until the mosquito season ends. So we're expecting that over the next few weeks, the weather is going to drop, and hopefully nature will help us out in controlling the mosquito populations. But for at least the next few weeks, we'll be in the area and testing all of the mosquitoes, all of the invasive Aedes that we catch in San Gabriel Valley for dengue. And no, we do test for, we regularly test for Zika and chikungunya along with dengue through our invasive Aedes mosquitoes. And so far to date, all of the mosquitoes found in our area have tested negative for those diseases as well.
We're not disclosing any information about the patient to protect her confidentiality. Thank you all. We really appreciate your attention to this matter.
Pasadena recibió confirmación de infección por el virus del dengue en un residente sin haber viajado a un país donde se encuentra típicamente esta enfermedad. Ese es el primer caso confirmado de dengue adquirido localmente en California. Una persona puede infectarse con el virus de dengue por una picadura de un mosquito infectado. En los Estados Unidos, los casos de dengue típicamente solo se ven en personas que han viajado recientemente fuera del país, como partes de Sudamérica, Asia y África. En los Estados Unidos continentales, los estados que han reportado dengue sin viajar incluyen Florida, Hawái, Texas y Arizona. El Departamento de Salud Pública de Pasadena tiene una relación establecida con el Distrito de Control de Mosquitos y Vectores del Valle de San Gabriel. Y juntos hemos estado trabajando para reducir las poblaciones locales de mosquito. El riesgo de infección es bajo.